Very thankful that you're here and excited that you're joining us today. We will be covering over the course of today and tomorrow the changes to the Resident Assessment Instrument Manual, as well as the MDS, or Minimum Data Set 3.0, version 1.17.1, just in case you wondered what you were here for. We will also be covering the changes associated with the Patient-Driven Payment Model, or the PDPM. Before we get started, I'm just going to go over a few housekeeping items for those who are participating in person here in Baltimore. So first of all, in terms of restrooms, if you go out the exits and then turn immediately to your left, you'll see that you'll go to the registration area, then turn back again to the left. If you walk down the hall a bit, it'll open up on the left-hand side to a lobby area, and if you go to the back of that lobby area, you'll find the restrooms. Secondly, for those here in the room, we do have Wi-Fi available. The name of the network is very simple, Four Seasons Meeting, and the name of the password is also very simple, CMS. So, and you'll be potentially using that a little bit later on as we go into the Slido, or our audience engagement tool. You'll notice also that a number of us are wearing yellow shirts or a yellow dress. We are here to help you. So if you have any questions or need any assistance, please don't hesitate to flag one of us down. Several people are waiting at the registration area. There's myself, Ephraim at the back table. So again, and if you happen to be wearing yellow and you get flagged down, we apologize. Let's see, and then the last thing that I wanted to mention is there is a table at the front of the room. It says reserved, and momentarily our closed captioning will be up. And so if you are having trouble hearing and you need assistance and you'd like to sit near a monitor where closed captioning is projecting, that would be the table to sit. And again, for you all facing me, it's the far table at the front on your right-hand side. So with that, I'm just going to go over a couple logistics, and let me fast forward. Could you advance the slides, Chandler, please, to the agenda? Thank you. So in today's session, we are going to cover an overview of the changes to the RAI manual and the minimum data set. We'll also have a presentation on the measure overview of the current SNF quality reporting program measures. We'll be doing an interactive session on the reports enhancements along with a case study to help you understand how you can use those reports to actually drive quality improvement within your organizations. Then we'll have Deb Weiland come up and talk about public reporting, and specifically the Nursing Home Compare website. And then we will have a substitute today, unfortunately, Casey Freeman, who was going to give the presentation on the SNF QRP resources, has laryngitis. So graciously, Robin Harper has offered to speak in her stead. And then we'll finish the day today with Section GG, a presentation by Manisha Das and Ann Deitch. So to help you with these presentations, for those in the room, we have a participant packet that you should have received when you signed in today. And you'll notice in the front left-hand pocket, there is a guide to tell you what is in the materials. These same materials, along with the presentations, are available to the participants who are online or who may have liked to check it out ahead of time. In response to a number of requests that we've received to make things simpler to find, we created what we call the Event Hub, and it is available at the following URL, went out with the instructions for participating. The URL is https://pac.training/SNF /August 2019 /. And that is sort of a one-stop shop where you can have access to both a printable version of the agenda, you can access links to the webcasts, you can access information about the audience engagement tool we'll use for participants here in the room and online. You can also access an online agenda, and within that agenda are the links to not only the presentations, but the materials that will be referenced during each session. And in some cases, it's more than the presentation. Those same materials are also available on the SNF QRP training webpage and divided into, to meet size limitations, 5 different files. So there's training day 1, parts 1, 2, and 3, and then training day 2, parts 1 and 2. And then within those zip folders basically is a folder for each of the courses, and within each course folder are all the materials that are relevant. So I'll just mention briefly that to assist with the presentations today, we have agendas available for you. There's also a presenter biographies list, so I'll briefly introduce each of the presenters, but if you want to know more about them, that information is available on the biography sheet. There's also an acronym list. So at the beginning of every presentation, we do reference the acronyms. And could we go to the next slide? Oops, I won't go to the, sorry. The acronym list is actually 2 slides in from this, and I'm going to get to that in a moment. But there's a comprehensive acronym list available in the packets of all of the acronyms used throughout the entire 2 days. And then there's an action plan, which we'll talk about a little bit later on, along with, in the initial folder for day 1, a sheet that you can reference throughout the day that lists the knowledge checks that we'll be asking you so that you have the full questions in front of you when you go to respond to them. So with that, I am going to go ahead and introduce today's speakers. The first speaker will be Teresa Mata, and she'll be again reviewing the changes to the RAI manual as well as the MDS 3.0 version 1.17. And Terry is an associate scientist and nurse researcher at Apt Associates. Prior to her current position, Ms. Mata worked for CMS as a post-acute care support matter expert in quality, or subject matter expert, I'm sorry, in quality measure and standardization data assessment development, guidance development, data standardization, rule writing across post-acute care settings, and helped to stand up the SNF QRP. So she truly is an expert in this area, and we're very blessed to have her with us today. Second, and up will be Alice Smith. Alice Smith will be presenting on the SNF QRP measures. Ms. Smith is a research public health analyst with RTI International, where she works on CMS projects. She is currently the lead for the SNF Quality Reporting Program, Provider Help Desk, Communication, and Training effort. Prior to working for RTI, Ms. Smith provided consultation and training to regional SNFs in prospective payment system management and the resident assessment instrument and minimum data set. Following Ms. Smith will be Jenn Pettis, who will be leading us through the enhanced reports presentation and case study again on how to use reports to really drive improvement within your facilities, quality improvement. Ms. Pettis is a consultant with Econometrica and also the Associate Director of the Long-Term Care Program for Nurses Improving Care for Health System Elders, or NICHE, at the New York University Myers College of Nursing. Previously, as a nurse researcher at Apt Associates, Ms. Pettis participated in data collection, analysis, and reporting of healthcare payment, quality improvement, and quality reporting initiatives, and provided technical assistance and training through a variety of post-acute projects. Following Ms. Pettis will be Deb Weiland, and Deb is very experienced in reporting. She is currently a nurse consultant with the Division of Post-Acute and Chronic Care at CMS. Prior to joining CMS, Ms. Weiland served as the lead program manager on the Quality Improvement and Evaluation System contract, supporting the post-acute care assessment submission and processing systems and downstream reporting of data, including the Quality Reporting Program Quality Measure Reports. And then leading us through a presentation on the resources available to you on the SNF QRP training or SNF QRP website, substituting again for Casey Freeman is Robin Harper. And Robin is a nurse consultant in the Division of Chronic and Post-Acute Care team at CMS. She serves as the MDS lead and works in the SNF Quality Reporting Program. Robin has been a nurse for greater than 20 years, with most of those years being devoted to the long-term care setting. Robin has been a long-term care surveyor for 22 years and was involved in training surveyors across the country in the quality indicator survey process and the new long-term care, survey process and the new long-term care survey. Prior to coming on board at CMS, Robin worked at Providigm, where she conducted annual and complaint survey assistance to state agencies who required assistance. She worked with providers on quality assurance and performance improvement training and support to ensure the best quality of care was provided to residents in the long-term care setting. And then wrapping up the day is Ann Deitch and Manisha Das with the Section GG presentation. Ann is a senior research public health analyst with RTI and was part of the team that developed the continuity assessment and record evaluation tool and was involved in training data collectors and data analysts in the Medicare post-acute care payment reform demonstration. Ms. Das is a research public health analyst with RTI International, where she works on healthcare delivery and policy projects with a focus on quality measures and standardized data elements, including functional standards collected in the post-acute care setting. Ms. Das has over 5 years' experience as an occupational therapist in a variety of healthcare settings. So we're truly honored to have such knowledgeable set of presenters working with us today. So I did mention acronyms, and I've already probably used more than I needed to. The acronyms that I used today in this presentation, among others, are CMS, Centers for Medicare and Medicaid Services, QRP, Quality Reporting Program, and SNF, or SNF, for Skilled Nursing Facility. Again, those are all available on the acronym list, and at the beginning of every presentation, we will cite the specific acronyms used in that presentation. So now moving on to the next slide, just a little general information for you. You probably noticed that the pre-training materials we posted don't have answers to the questions or the knowledge checks. We purposely don't provide those answers because it really helps us gauge your understanding of the materials if we see how you're responding. And that way, if we see that you're not responding to a specific question the way we thought the answer should go, the presenter knows that they should spend a little more time on that particular topic. All of the training materials with answers, however, will be posted to the SNF QRP training page on the CMS website following the training, along with a link to video recordings, which will be posted on the CMS YouTube site. And certificates of completion are available. They'll be emailed to anyone who participates in person, or if you're participating online. We're going to talk about Slido in a couple moments. That's our audience engagement tool. If you respond in any way, shape, or form to 80% of the polling questions between today and tomorrow's presentations, we will email you also a certificate of completion, because we know that you have been fully engaged in the entire 2 days worth of training materials. So now, moving on to the next slide, we're going to actually talk about Slido. So for those in the phone or in the room and online, if you wouldn't mind getting out your cell phones, you'll be using it today, and that's why in our instructions we said, please bring a fully charged cell phone to the training. So we use Slido for a couple things. The first is for responding to polling questions, but it's also how you'll submit questions to us, and we'll talk about that momentarily. But to get started, if either on a cell phone or a laptop, you open up your browser and type in www.slido.com, and Slido is S-L-I-D-O. And then you'll get to a screen that looks like the one that's being projected. And when you get to that login, just type in the word econometrica. It is not case sensitive. Econometrica is E-C-O-N-O-M-E-T-R-I-C-A. And so with a raise of hands, if folks in the room will let me know when you've accomplished that and gotten into Slido, that would be very helpful. Seeing hands going up. We're going to give the people online just a couple moments to also catch up with us, because we've got about a 6-second lag. And if you happen to forget any of what I've telling you about Slido, all that information is available on the event hub that I referenced earlier. Again, that address was https://pac.training/August 2019/. And if you happen to access Slido from there, you don't even have to log in with the Econometrica login. Okay, so we will be trying to do a couple polling slides. We're going to give it a try. So I'm going to ask some questions, and as I ask the questions, the poll will come live on your phones. If you answer with what you think the correct answer is, we'll then see how people are answering, and we'll then check out the correct answer. So the first poll we're going to try is, what famous jazz singer was born in Baltimore in 2015? Was it A, Billie Holiday, B, Herbie Hancock, C, Louis Armstrong, D, Ella Fitzgerald? And so far, we have a lot of votes for Billie Holiday. And I see people are still voting. Numbers are shifting. Louis Armstrong is a strong second. Okay, I still see quite a few answers coming in. But let's go ahead and see what the correct response is. So the correct response is Billie Holiday. So congratulations, most of you got that question right. So we're going to try a few more just so you get the hang of it. So next question, Baltimore is home to which of the following? And this might be important tonight when you're out looking for something to do. The National Aquarium, the School of Nursing Living History Museum, the National Museum of Dentistry, or all of the above? Okay. Still seeing responses coming in. And I think we can see the National Aquarium from here, so that's a good answer. But let's see which is the correct response. Correct response is D, all of the above. So there's lots to do here in Baltimore. Let's try one more question. So Francis Scott Key wrote which of the following at the Battle of Baltimore in 1814? A, America the Beautiful, B, You're a Grand Old Flag, C, the Star-Spangled Banner, or D, Take Me Out to the Ball Game? Okay. Looks like we have a lot of votes for the Star-Spangled Banner. And let's go ahead and see the correct response, which is, in fact, the Star-Spangled Banner. So again, congratulations. Okay. Let's see. And next question, this is more, there's no right or wrong answer, obviously. So if you would respond, I know A, the person on my right, B, the person on my left, C, people on both sides of me, or D, I haven't met my neighbors yet. So this is a great opportunity to network and learn from your colleagues, which we'll talk about a little more later. And for those online, we're hoping that you're feeling connected by participating using Slido. So I encourage you to get up, move around if you're here in the room, and really meet people. So let's go on. I'm going to actually suggest that we skip to the asking questions. So we really need your help when it comes to helping us help you get answers to the most important questions. So from that perspective, a couple tips. One, we really suggest that you wait until toward the end of a presentation to submit your questions. And the reason for that is specific. And that is, if we're inundated with questions, it's really hard for us to kind of answer all of them. So if we can get really questions that aren't already covered in the training materials from you, that will give our experts at lunch a better opportunity to answer your questions. So now if we could go to the next slide, I'm going to ask you to set up a profile. And the profile is important for two reasons. For those participating online who would like to get a certificate of completion, we won't know who you are unless you set up a profile. And then for those who are here in the room and online, it's very important that you set up a profile, because if we have a question about your question or aren't clear on what you're meaning, it's helpful to us to have your email address so that we can email you for clarification. So to set up your profile, you'll notice that in the upper right-hand corner of your screen on Slido, there's a little head and shoulders. If you click on that, it'll take you to the next screen. And if we could move forward, please. You'll have the opportunity to enter your name and your email address. And if you could please enter that information. Once you have that entered, you'll notice that little icon changes to the first initial of your name. So to give me a clue as to how we're doing, if people in the room would raise their hand once they have entered their name and email address and clicked send or submit. Great. And everybody's seen that now you have a little initial instead of your icon? Raise of hands? Okay, I think we're there. So we're going to practice just entering one or two questions. So you can enter any question that you would like at this point, and then we'll erase those. And once a question is entered, you'll see that you have the opportunity to like it. And again, to help us answer your questions, it really helps us to know which questions are most important to you. So rather than re-enter a question, if you would just like a question, if it was one similar to what you would have entered, that way we'll know we're going to try and focus on those that get the most likes to answer during the lunch hour or at the end of tomorrow. So again, just a couple things. It's important again to hold off asking questions. In fact, in this first presentation, which is the overview of the changes, we're asking wait to ask your questions. Wait until the full presentation, because likely many of your questions will already be answered. If you are having any technical challenges, however, you can't hear us, if you're participating online, you need help accessing materials, Ephraim and Chandler will be busy answering those types of questions during Terry's presentation. And I think with that, I'm going to advance one more slide. We talked about upvoting questions. Let's go one more slide, please, Chandler. Okay, and the last item I'm going to talk about is recording your action plan ideas. So in terms of your action plans, they're in your packets. That's an opportunity for you as you're listening to presentations. There's a page for each presentation to jot down your ideas about how you're going to operationalize all this when you go back to your facilities. Are there procedures that need to be reviewed, policies that need to be reviewed? Do you need to connect with your IT department if you're using an electronic health record? Do you need to train staff? It's a good idea to write down some of those ideas so that when you go back, you have a blueprint in terms of operationalizing the information that you get today. And so, with that said, I'm going to turn the mic over to Teresa Mata, who's going to cover the overview of the changes to the RAI manual and the item set. Thank you, Terry.